Thank you. As you can hear, we are recording this session. We will post the recording to the PGCPS benefit website within about 48 hours of the end of this presentation. Tonight's presentation is from Kaiser Permanente, and we have Miss Janine Ziegler, who will do the presenting for us. We're going to ask that everyone stay on mute during the presentation, and if you have any questions, please feel free to put them in the chat, and we will address those questions at the end of the presentation. We'll have plenty of time to address all questions. However, we do ask that the questions be related to the presentation and the Kaiser benefits in general. We're going to ask that we don't have any personal questions about your medical expenses or experiences with Kaiser while on this session, and those can be Janine can if anyone has any of those questions, can let them know who to contact at Kaiser. So we're just going to focus on the presentation today. Any questions related to the Kaiser benefits can be put in the chat, and we'll have plenty of time to go through those at the end. And I'm going to turn it over now to Miss Janine to start the Kaiser Permanente presentation.
Thank you so much. Good afternoon, everyone. Happy Hump Day. Thank you so much for joining to learn a little bit about Kaiser Permanente. I hope everyone can see my screen, and if so, I'll begin. I'm going to start with the question, what makes you feel happy and healthy? I don't know about you, but for me, there's never enough time in the day. So when I can minimize the time that I spend taking care of the necessities of life and maximize the time I have for entertainment, relaxation, downtime, doing the things that I want to do, it's a win for me. So when you have a co-connected healthcare plan, a patient-centered, co-connected healthcare plan that is really conducive to finding your healthy place. With Kaiser Permanente, the doctors, hospitals, and health plan are all combined, which makes for seamless care for our members. Why choose Kaiser Permanente? Well, we are one of the leaders in quality, one of the top healthcare plans in this region and in the nation. We are the leaders in preventative care. We are also the leaders in telehealth, so you've got a number of options to choose your type of care, the care that you'd like via phone, via video visit, in person. You have a number of options. You can get advice by email, phone, or online. And of course, you have access to the Kaiser Permanente mobile app 24 hours a day, 7 days a week. That gives you access to your doctor and your entire medical profile and all of your healthcare options and tools and resources in one place, 24 hours a day. And you'll also find that we have a large number of value-added resources, self-care resources that really help you be the best you that you can be. And I mentioned we are one of the leaders in clinical quality. So we lead the nation in breast cancer screenings, diabetic blood pressure control, and blood pressure control. We're very proud of that, and you can access our board certified physicians in more than 50 specialty practices. Our physicians have been recognized for the stellar care that they provide their members, their patients. I mentioned some of the self-care value add resources that are available to you as a Kaiser Permanente member at no additional cost. One of our newest resources is the Ginger app. And with the Ginger app, you have 24/7 emotional support coaching, 24/7 for 90 days at no additional charge. And the support coach is at your disposal. You can discuss anything that you'd like to. You can discuss goals. You can share some of the challenges that you're experiencing, and you can create an action plan to really help improve your quality of life. You also get personalized interactive skill building tools from a library of more than 200 activities. We're really proud of this resource because As a nation, we face a mental health crisis. There is a shortage of mental health clinicians and providers throughout the country. So this is in addition to adding physicians and expanding our network. I'll talk about that a little later, but this is one of the things that we've added to really meet the demand for healthcare, mental health resources, and emotional support. Some additional things that we have available to our members: ClassPass, which is a program where members have the ability to access more than 4,000 on-demand fitness classes. You name it, boot camp, yoga, whatever you want, you can do it from the comfort of your home. We have self-care apps, Calm and My Strength. Calm really helps with sleeping and relaxation. My Strength helps with depression and a number of other things. So these are award-winning apps that are also available at no additional cost. Wellness coaching by phone, that's something that you have available, and it's actually a very underutilized resource. But you have your own wellness coach that you can talk to by phone at a time that's most convenient for you, and you can get coaching for any healthcare issue or any medical issue that you'd like to seek help for. KP.org, we have a plethora of healthy lifestyle programs. You can customize a plan to quit smoking, lose weight, eat a healthier diet, incorporate more exercise into your daily routine, reduce stress, reduce depression, just whatever you want to do, you can customize a plan to meet your healthcare needs, in addition to some of the other things that you see here. We offer discounts on specialty care services like acupuncture, chiropractic care, massage therapy, and gym memberships, in-person gym memberships. And we still have the on-site brick and mortar health education classes at our medical centers. Our medical centers are fully open and operational, so you can still go in person and you can take classes. You can see a nutritionist. You can take a class in step diabetes, healthcare, heart health. There are a number of classes available at our medical centers that you can attend in person at no additional cost. And then we have virtual health education classes online. I just mentioned ClassPass. I mentioned Calm, just a little bit more detail here. 10-minute daily Calm meditation, guided meditations for anxiety, stress, gratitude, and sleep stories to help you sleep. And the last time you needed care, what did you have to do to get it? So that's the million-dollar question, right? So just to expound a little bit more on what I mentioned earlier, you have a number of options to seek care at Kaiser Permanente. You can visit us at any one of our 35 plus medical centers. As we continue to grow membership, we continue to expand our geographic footprint. So later on in this presentation, we'll talk about our new medical centers that have just opened. So you can visit us in one of our medical centers, or you can talk to a healthcare professional by phone or video. And this is such a convenient resource that really came to the fore with the pandemic. And now that we've always had this resource, but utilization increased with the pandemic, and we see that now more and more of our members are utilizing phone and video visits. You can have a video visit or a phone visit anywhere you are, in your car, in your office, whatever is most comfort of your home, whatever is most convenient for you. However it's convenient to seek care, you can do that at Kaiser Permanente. You have 24-hour virtual care. We have our 24-hour advice line manned by licensed clinicians. So you can get advice. You can have your condition triaged. You wake up at 3 a.m. and you've got a fever, or your child is sick, and you just kind of want to get some direction on where to go and what to do. That's what the advice line is for. It's there for you. They can make an appointment for you for an appointment with your doctor the next day, but they can also coordinate a visit at one of our urgent care centers, or if need be, at one of our participating hospitals or emergency room. So a great resource to have, great peace of mind, knowing that you can talk to someone 24/7 that will have your entire medical profile at their disposal. So they're going to see your medical history, your conditions, your medications, and all of that good stuff. So they're not just going to triage you and direct you blind. They're really going to have your entire profile um, at their fingertips. You can, via our 24-hour advice line, or via our Kaiser Permanente app, or you can go to kp.org on your computer. You can schedule vaccinations and routine appointments. You can email your doctor with any questions. You got your doctor at your fingertips 24 hours a day, and that is also a phenomenal resource, one that I utilize all the time. You can order a COVID-19 self-test, and you can, well, that was the first point, you can schedule a appointment to get a vaccination. You can see your test results online. So that's really good with regards to having access to your medical record. You can see your test results, you can see how you're trending, you can compare it to previous tests. So this is really a phenomenal resource to be able to have access to your medical records, and you'll find information on the test, why it was ordered, certain conditions, explanation on the results, and of course that doesn't supersede, the results that you get from your doctor, but the doctor will also add additional notes in the test result field as well. You can get your prescriptions, you can get them at our medical centers, or you can do mail order, or you can do same day pickup, again, whatever's most convenient for you. Care away from home. At Kaiser Permanente, you have the comfort of knowing that you can get urgent and emergent care and coverage anywhere in the world. Literally, we've processed foreign claims. So anywhere you are, you have access to care and coverage. And I'm pleased to share, last year when I did this presentation, I talked about the partnership with Minute Clinics, CVS Minute Clinics, and Concentra Minute Clinics for the regions where we don't have a presence. Well, now we further enhanced that, and our members have access to the Cigna PPO network when they're traveling outside of our service area. So just another way that we want to make care comprehensive, seamless, convenient, and stress-free. So now you can access the Cigna PPO network as a Kaiser Permanente member when you're outside of our service area. Now, when you're in our service area, any one of our regions, for example, the Atlanta area, the Georgia region, Northern and Southern California, Hawaii, any of our regions where there is a presence, when you visit, you get unlimited visiting member status. So that is an awesome option to take advantage of as well. If you have a serious health need, do you know how to find the right doctor? I recently had a conversation, and a member was saying that prior to Kaiser Permanente, they really had difficulty finding a physician, and they kind of didn't know where to go. Well, no matter what your needs, you have access to great doctors, advanced technology, and evidence-based care to help you recover quickly. We do lead the nation in our care. We've got award-winning cancer care programs, kp.org cancer care, kp.org cardiac care, kp.org maternity care. So these are some just highlighting just several of our specialty care practices. You can go online and you can go to the physician's webpage, and you can take a look at our physicians. You can see where they went to school. You can see where they did their residency. You can verify their board certification status. If you prefer a physician, that you can speak to in your native tongue, or you prefer, male versus female, you'd like to know a little bit about the doctor, their hobbies, any articles, anything they've published, you can see all that information as well. So right up front, you've got a bit of information to make a somewhat educated decision. You can choose your physician. If you don't like that physician, you prefer a different bedside manner, you can change your physician as often as you like. And that physician is your dedicated personal physician. That is the physician that cares for you and helps you meet your healthcare needs. So the only time you don't see that physician is if they're out of the office and you need to get in for an urgent appointment, then you'll see a member of their healthcare team. So mental health services, I touched on kp.org/mental health. There you can find a wide range of resources really to help you be balanced, to get balanced, and just great resources to help you with whatever you're dealing with. There's even a link to like the national mental health resources lines. And so there's links to information that's available outside of Kaiser Permanente. So lots of good information for you to take advantage of from the comfort of your home. So let's look at your group specific benefits. PGCPS has the HMO Plus plan. So just very briefly, the HMO Plus plan is a plan that we created because one of the biggest barriers that we found a number of years ago when we did open enrollment meetings and whatnot was, we love, we hear all these great things about Kaiser Permanente. We love the convenience and, you're just great. We would choose you, except I don't want to leave my doctor. So we are so pleased to share that we removed that barrier. So with the HMO Plus plan, you have the option to utilize 10 out-of-network visits with any licensed physician in the United States. So if you want the convenience of our one-stop shop care delivery system where, you go and get your labs, x-ray, pharmacy, imaging, see your specialist, get a flu shot, get a COVID vaccine, go to the vision center. I mean, you can go and one-stop shop, take care of all of your healthcare needs. You can see your doctor there. You've got all of that good stuff. But if you still want to keep that, OBGYN that delivered your child, or you've got this award-winning, cancer specialist at Hopkins, whatever the case may be, you have the best of both worlds with the PGCPS HMO Plus plan. You've got our care delivery system, and then you've got the 10 out-of-network visits to see any licensed provider in the US. And that's a lot because, unless you've got very serious health issues, most people don't go to the doctor, more than 10 visits a year. So here are your benefits. Of course, there's no deductible or coinsurance. Of course, preventative care is at a zero copay, and it was prior to healthcare reform. So basically, your annual exam, your kids' annual exams and screenings and whatnot, all of those services are at a zero copay. Your mammogram, anything, any screening, preventative care, annual exam, zero copay. Outside of that, a doctor's visit with your primary care physician, $10. Your specialist, when you go see your ophthalmologist, you go see orthopedics, your orthopedic surgeon, any specialty care, it's a $20 copay. And then the HMO Plus plan benefit is $30 for any licensed physician, family practitioner, or I forgot what in internal medicine. Family practitioner sees adults and children, internal medicine and just adults. So you can see any licensed physician, $30 copay, any licensed specialist in the US, $40 copay. Lab tests and radiology, 0 copay, outpatient surgery, 0 copay, hospitalization, 0 copay, emergency care, ER visits, $150 copay. And this recently changed as of this year. You get a 30-day supply of medication, $7 for generic, 15, brand name, 30, non-preferred brand. That's at our Kaiser Permanente medical centers, and all of our medical centers in the Mid-Atlantic region have pharmacies. So we incentivize our members to use our pharmacies because we can pass on these discounts as we're the largest purchaser of pharmaceuticals in the nation. And then you still have a community pharmacy benefit. So what that means is you have access to community pharmacies, Giant, Walgreens. You can check online for the directory. Most community pharmacies participate with Kaiser Permanente. It'll cost you a little bit more because, again, we want you to go to our medical centers. And of course, you've got mail order. But if you for whatever reason, you want to run to that Giant that's, right there, walking distance from your house, it's 20 for generic, 30 for brand, and 50 for non-preferred brand. For a 90-day supply, 3-month supply of medication is at 2 copays. Vision and eyewear benefits, 19 and older, 25% discount. Up to age 19, 1 free pair of glasses a year. And I think I just mentioned that within our medical centers, we also have really nice vision centers, great frame selection. So stop by and visit if you join Kaiser Permanente, are really nice vision centers. We are growing by leaps and bounds. So this is just an overview of our footprint here in the Mid-Atlantic region. So you'll see where our medical centers are located, the new medical centers that we've opened. We have 15 urgent care centers, and 8 are open 24/7. And speaking of which, the ones that are open 24/7, they're called advanced urgent care centers, and they are located in what we call our multi-specialty practice hubs. And those are medical centers where 24 hours a day, 7 days a week, you can go and get your lab, pharmacy, x-ray, lab, pharmacy, x-ray, and prescriptions. No, I said prescriptions. Lab, pharmacy, x-ray, and urgent care. 24 hours a day, 7 days a week. So if you just want to get up and go to the pharmacy or go get some labs or x-rays done, in the middle of the night, you've got the ability to do so if you want the medical center all to yourself. And I do that all the time, by the way. And those multi-specialty practice hubs are located South Baltimore Medical Center, the Largo Medical Center, Tyson's Corner Medical Center, Gaithersburg Medical Center, Woodbridge Medical Center, and Cap Hill Medical Center in DC. The newest medical center that we just opened in Prince George's County is the Hyattsville Medical Center. Absolutely beautiful medical center. This medical center is replacing our Prince George's Medical Center that was on Bellcrest. Just beautiful, beautiful medical center. It's a smaller version of the Bowie Medical Center. Last year when I did this presentation, I highlighted our beautiful Bowie Medical Center that recently opened a couple of years ago. Hard to believe. So this year, a couple months ago, we opened Hyattsville. I don't know if anyone that works with the school district lives in the Baltimore area, but we just opened the Caton Hill Medical Center. And I think this is now, Largo used to be our largest medical center, but now I think it's Caton Hill. Our Springfield Medical Center our new Springfield Medical Center is opening November next month. So that's going to be exciting. Lutherville Timonium just opened another phenomenal state-of-the-art medical center, and you can see some of the specialty care practices that are located there. And that's it. I thank you for your time, and I hope to see you at Kaiser Permanente. I'm going to stop sharing and open the floor for any questions, any feedback, issues, concerns. I love to respond to anything that anyone may want to share.
Thank you, Janine. Yep, and if anyone feels comfortable coming off mute and has any questions or comments, feel free. And just remember, we are recording. Or you can put your question in the chat if you prefer.
Okay, don't be shy. Somebody has to ask me something.
Good afternoon. Thank you for the information. I do have a question. Maybe you already said it, but probably my audio went out. So Kaiser covers medical and prescription. Is that correct?
I'm sorry, I was muted. Yes. It's a medical health plan, so that includes vision, and it includes prescription. So the price that you see, the cost of the healthcare for you, that very much includes the pharmacy.
Thank you so much.
You're so welcome.
Thank you. Great question. Any other questions for Janine? So just as a reminder, open enrollment started on Monday, the 10th of October. It ends on October 26th. So that's the time when employees can log into Oracle Self-Service and make any changes to their benefits. Any changes that you make are effective January 1 of 2023. If you don't log in and make any changes, your benefits will stay the same as they are right now. And you can find all the details about open enrollment at pgcps.org/benefits, and then you'll see the open enrollment link.
I think I see a question. Wade Garris?
Yes, hi. Thank you for the information. My question is, I'm already a Kaiser person, but I think I want to change to the HMO Plus. How do I know if I am an HMO Plus? And do I contact the doctor that might be out of network?
That's a great question. And I'm so glad that you asked this question, because I just remembered something that I forgot. So we replaced our signature HMO Plus plan with the HMO Plus. So every existing Kaiser Permanente member, when we did that 2 years ago, automatically has HMO Plus. So there's nothing you have to do. You already have that plan. You can go online. You can go online and look at, how to access the physicians. There's a microsite. I don't know, Betty, if you want to put the microsite in the chat, but it's PGCPS. It's my.kp.org/PGCPS. And that is the microsite for the school district. And that microsite gives you the SBC, the EOC, all of that information. Michelle just asked us to update that earlier this week. So we've got the latest information there, and you can get information about HMO Plus. You can do a virtual tour of the medical center. You can get information, just a plethora of information. Thank you so much. And one of the things that I forgot to mention, I mentioned mental health and the crisis that the nation is facing. And one of the key things we did was we have now expanded our network of mental health providers to extend to community-based providers. So yes, you can now see providers outside of the Kaiser Permanente medical centers, outside of the HMO plan, and not via the HMO plus. You don't have to use your 10 visits for that unless you want to. This is just an enhancement to our HMO, our standard HMO signature plan, where we now have opened up our network to include community-based mental health providers. And you can get that information online in the mental health section or the provider section of our website. And, we're always available for questions. So any questions that you have, please do not hesitate to reach out and contact us. Let me put my okay. Oh, didn't spell that right. Janine.hill@kp.org. Okay, so anyone in this meeting or anyone that listens to the recording, if you have additional questions, more specific, just reach out and we'll do our best to help you. And we hope to see you at Kaiser Permanente.
Thank you, Janine. I did post a couple links in the chat right above Janine's email, the link to the Kaiser microsite, and also the link to just the benefits webpage where you can find the Kaiser Permanente webpage and all the other web pages for your PGCPS benefits. If we have no other questions, real quick, any other questions before we end the meeting?
I just want to make sure, Ms. Garrison, you have another question, or did you just not put your hand down?
Oh, I guess I just didn't put my hand
Oh,
down.
okay.
Thank you.
I just want to be sure.
Thank you.
Thank you. Anyone else? Any other questions? And I see Miss Marshall put her email address in the chat as well at from Kaiser.
I think I do have one question, but I'm not sure if it's like related to what she presented this afternoon. So I'm already a Kaiser Permanente member, but I'm trying to get my husband to come and join a KP. He currently has his insurance through his employer, but if I enroll him this year, does he need to notify his employer prior to January 1st of next year, or how does it work?
I can answer that, or Jamie, but basically during open enrollment season, this is the time to enroll him, and then he would, during his open enrollment period, terminate his coverage. Just make sure that both plans have a 1/1 effective date, so there's no lapse in coverage. If for some reason his employer has an off-cycle renewal period, just find out when it is. So again, there's no lapse in coverage. But if you both have 1/1 effective dates, then his open enrollment should be coming up and he can terminate, and then you put him on your plan. So 1/1, he'll be effective with Kaiser Permanente. Was that what you were looking for?
Yes, thank you.
You're welcome.
Yep. I was just going to say the same thing. That's exactly how you would do it. Even if he doesn't have, if his enrollment is, let's say in July, you should be able to add him during our open enrollment now, and then show that to his employer, proof that he's enrolled as of 1/1 for our plan, and they should be able to let him come out of his plan if it's not the same open enrollment period. All right.
Thank you.
Yep. Great questions. Any other questions? All right. Well, not seeing any, I think we will go ahead and end the meeting. Again, thanks everyone for attending, and thanks to Janine from Kaiser for that wonderful presentation. Again, we'll have this recording on the open enrollment web pages in about 48 hours, and you can certainly watch it anytime. And if you have any additional questions, you can always reach out to Janine at kp.org, or certainly you can reach out to the benefits office if you have specific questions about PGCPS benefits, and we can always assist. Thanks again, everyone. Have a great evening.